As athletic trainers, we've been a physician extender since the inception of our profession.
There's no doubt that the athletic trainer's role has changed and expanded.
I think the most rewarding part of our job is to be able to relate to the patients and talk to them.
Helping our efficiency, helping us stay organized, helping us provide good, effective, safe patient care.
Hello, I'm NATA President Marjorie Albom. People often ask me, where do athletic trainers work? And I'm proud to say, where don't we work? Athletic trainers today can be found in a variety of settings: industrial, performing arts, military, professional sports, college, university, high schools, the clinical setting. Anywhere you find physically active people, that's where we are as athletic trainers. People of all ages. One of the fastest growing environments for athletic trainers, and this is exciting, is the clinical setting. Physicians who we've worked with for years on the sidelines have now taken us into their clinical practice. We see patients with them, and in that role, athletic trainers are referred to as physician extenders, which is the healthcare model. The purpose of this video is to share this exciting information and profiles of these athletic trainers who are serving as physician extenders in physician clinics. You will see their unique skills and abilities and how this is a natural fit for athletic trainers. In addition to this video, there is a wealth of information on the NATA website. The demand for athletic trainers as physician extenders is growing, and we look forward to working with you in developing that further growth.
When I came here to Emory, it was a new concept for me. Athletic trainers, in my mind, were folks that support athletic teams. I think that how you change that thinking and where the value really comes into play is that they have a very rich skill set around understanding the mechanics of the body, and that can apply to all ages and all levels of fitness.
Well, I think athletic trainers are a good fit for a practice like this because we learn through being a student athletic trainer and your graduate assistantship, we learn hustle, we learn urgency, we learn dependability. It's musculoskeletal assessment. Our education prepares us for this.
Athletic trainers have years of physiology, kinesiology, and experience with exercise and sports science. And they also have many, many years of experience with musculoskeletal injuries, especially those that pertain to the athlete.
Who's an athlete? An athlete's anyone active. You know, our patient population comes to see us, see our doctors because they want to stay doing whatever activity it is, whether it's walking, playing tennis, whether they're 40, 50, 60, or 18, or one of our NFL athletes or professional athletes. Somebody may not be getting paid college tuition, being paid professionally to play a sport, but most people like their activity, like their lifestyle. And whether we're treating an athlete per se, we're treating people who are athletic and who are active.
Their skills are very well suited in dealing with the types of problems, injuries, and rehabilitation that our patients require. So it's really a perfect marriage between their skills as musculoskeletal specialists and the type of patients and injuries that we see.
They bring a level of clinical expertise that allows us to bridge the gap between patient and physician who, as you know, may be very busy and could be in the clinic today but in the OR tomorrow, and the athletic trainer is key in the communication loop.
When the doctors give them a diagnosis, a lot of times they say, you tore your ACL, the patient, their brain just shuts off and they stop listening. So the doctor walks out of the room and then all of a sudden the questions come out like, what does that mean? What is the surgery going to be like? What's my post-op recovery going to be like? What's my therapy going to be like? And that's something that we can answer for them and talk them through.
That's just something we do. You know, we've been athletic trainers, we've been working on the sidelines, we've been doing it, we've had to deal with parents, we've had to deal with coaches, with kids, with athletes, and it's a matter of taking the physician and the patient's needs and tying it in together.
It was a complete, absolute sever. So it was here.
Here, our athletic trainers are actually part of the OR team, so they scrub in with the physician. So not only are they there for your preoperative visit, but they're in the OR with you while you're actually undergoing a procedure. So they understand the diagnostic aspects of it in the outpatient setting. They're there when you're operated on, and they're also there when you come for your postoperative visit.
We talk about these surgeries and the way they're done, the way their post-op plan is. We talk about those almost weekly in journal clubs and grand rounds, and you're constantly hearing about it, and then you could see it, you put the pieces together, and I think it's an awesome experience. You have to be able to multitask, you have to be able to think about several things at one time, and I think that's an important thing to do, because the more efficient you are, the more efficient your doctor is going to be, and the more stuff that you can take care of takes that off his plate, and I think they see that as valuable.
Athletic trainers you'll find to be mature, competent, well-trained, outstanding musculoskeletal providers with a true interest in musculoskeletal pathology, triage, diagnosis, and management.
By having the athletic trainer able to go in to evaluate the injury, do a history, physical exam, special test, to come out with an answer to the physician, that's going to make that physician's job a lot easier, because they're not have to go through from A to Z. They're already starting at step M, we'll say. So they just have to finish that up. That gives them more quality time with the patient, but that also gives them, that athletic trainer's out there seeing another patient. That gives it more time, you can see more patients.
The athletic trainer has to fluidly move between those patient populations. It's also the case that, like any busy clinical practice, they need to be able to answer calls from patients that may be urgent. There may be a question coming from the OR that they need to deal with. And also just some of the administrative matters that come into healthcare these days. So our athletic trainers have to be highly poised, intelligent, articulate multitaskers, and that is part of the reason that we hire them, because it's a skill set that they bring to the table.